Okay, hi. So this is the reconstitution process for the coronavirus vaccine. So initially when it comes, it will be obviously thawed out and in the fridge for you. You have 2 hours from the time that you remove it from the fridge to when it has to be diluted. So the first step is to record when you've actually removed the vaccine from the fridge, and what we're doing at the moment is we're putting it in a light sensitive box. So the vaccine is very sensitive to movement and also light. So I've got a box here. I've already removed the vials from the fridge, and if you just look on here, what I've done is you can use whatever way you want to do it, pre-printed labels or whatever, but I've documented the time I've removed it. So I've removed these vials at 11:07. That means it has to be diluted within 2 hours, so I have to dilute it before 13:07. Once it's diluted, that vaccine has to be used within 6 hours. Now, the SPC states that the vaccine has to be at room temperature before you do anything to it, so in terms of inversions or dilution. So we're waiting for Pfizer to give us absolute confirmation, but we've taken a decision to leave it out in the box at room temperature for about 10 minutes. That should be enough to warm it up. Once it's been 10 minutes, so after 11:17, I should be able to dilute this safely. So it is now 11:18, so this has been in there for 10 minutes. So I'll just show you now the reconstitution process. So very gently remove the vial and put it into your tray. This tray has been wiped down as well. And you'll need 2 alcohol swabs. You'll need a vial of sodium chloride, 0.9%, which is provided for you. And you'll also need a 2 ml syringe. Okay, so to begin the process, gently lift the vial and invert it 10 times. So 1, 2, 3, 6, 9, and 10. Okay. Gently place back into the tray. Remove your first alcohol swab. Gently remove the purple cap. Discard. And then just swab the top. Put it down. And then we'll also swab the sodium chloride ampule. And twist to remove the top. And then set that down. And then prepare your syringe. So these syringes will be provided for you. They're a 2 ml syringe. Leave the syringe in the fold. Remove and place. Press firmly and grip the green barrel there and then pull away. Otherwise the whole device will come off. Then gently grab your vial at an angle, leave the needle inserted in the liquid the whole time, and the plunger or the bung on this vial is very easy to read. It's completely flat, and you want to withdraw 1.8 mils, so leave at a slight angle and start to draw, and you'll notice that there will be some air in there which you will have to expel. So I will draw about 2 mil to start, and then making sure that the tip of the needle is still inserted in the liquid, push back to expel any air that's trapped at the top. And it's okay if some of the liquid drips into the tray, that's fine. And then just make sure you've got 1.8 mil.
I'll try and speak to you in a bit.
And there's no air in there either. That's fine. And gently pick up your vial, and what you'll do is you'll have to insert the needle into the very middle of the bung, because all the injectors will be using the outside to inject at 5 different points. So gently put into the middle, insert, and hold at an angle and trickle the sodium chloride into the vial, as it is very fragile at this moment. So we're going to slowly put it in, and as the vial is pressurized, you will feel some pressure, back pressure, as you're starting to put the liquid in. Just push through until the whole 1.8 mils is in the vial. Once the full amount is inserted, make sure that the needle is completely out of the liquid and slowly release the plunger to remove the air. And withdraw 1.8 mils of air to equalize the pressure in the vial. Okay, remove the syringe. Discard it. Then you need to invert it another 10 times. 1, 2,
3. I really thought I'd like, because you know me, I like a bit of a blob. I reckon I'll blob after tomorrow.
Set it down, and then you need to, what we're doing is we're recording. You have some pre-printed labels, and so it's 11:23 at the moment, so I've